Sarah Mason was no stranger to early morning swim practices. She loved the feeling of cool water rushing past her, the rhythmic sound of her breathing echoing in the stillness of the indoor pool. But on a breezy Saturday morning in late June, 1 week before the biggest swim meet of her life, Sarah sensed something was off. Her right ear felt strangely clogged after practice, as if water was still trapped in her ear canal. She shrugged it off. After all, she had a busy day ahead. Little did she know that this seemingly minor inconvenience was about to become her biggest hurdle yet. The subtle clues. That evening, Sarah began feeling a persistent itch in her ear. She tried shaking her head gently and even used the corner of a towel to dab at the outer ear, hoping to draw out any trapped water. Yet the itch turned into a dull ache. By nightfall, a sharper pain set in, like tiny pinpricks whenever she touched the outside of her ear. Disturbed, but still hopeful it would disappear by morning, Sarah drifted into a fitful sleep. The next day, the situation worsened. If she pressed the small flap of cartilage in front of the ear canal, the tragus, or gently tugged on her ear lobe, the pain was excruciating. To make matters worse, a thin, watery discharge began to leak from her right ear. Concerned, Sarah decided to contact her family doctor, Dr. Hernandez. Over the phone, Dr. Hernandez listened to Sarah's symptoms: ear pain, tenderness upon tugging the ear, itching, and a discharge that had begun to smell a bit off. Dr. Hernandez scheduled an urgent appointment. The investigation begins. On Monday morning, Sarah arrived at Dr. Hernandez's clinic, anxious and in pain. Dr. Hernandez greeted her with a reassuring smile. History examination. Chief complaint: severe right ear pain, otalgia, with a history of recent swimming, associated symptoms, ear canal itching, watery discharge, foul smell, tenderness on tragal push. Physical examination. Dr. Hernandez gently examined Sarah's ear using an otoscope. Bright light fell upon an angry red and swollen ear canal, coated with debris and moisture. As soon as the otoscope touched her external ear, Sarah flinched in pain. Dr. Hernandez explained that the external ear canal appeared inflamed and irritated, classic signs that pointed toward otitis externa, often called swimmer's ear. Differential diagnosis: bacterial otitis externa, most common cause, frequently due to Pseudomonas aeruginosa. Fungal otitis externa, though less common, it usually has a thick, white or black fungal growth. Ear canal eczema, less likely, but can mimic infection. Given Sarah's history of frequent swimming and the presence of watery, sometimes foul-smelling discharge, bacterial otitis externa was the prime suspect. Confirmation of the culprit. To ensure proper treatment, Dr. Hernandez gently cleaned Sarah's external ear canal, a process called oral toileting or ear debridement. Using a tiny suction device and cotton-tipped applicators, she cleared away debris and drainage. This not only helped relieve pressure, but also allowed better inspection of the canal's lining. Now, with a clearer view, Dr. Hernandez was almost certain the inflamed red canal was consistent with classic, acute otitis externa. After discussing Sarah's symptoms and risk factors, especially her daily swimming routine, Dr. Hernandez explained that the constant moisture in her ear canals likely allowed bacteria to thrive. The diagnosis: acute bacterial otitis externa. The treatment plan: Dr. Hernandez offered Sarah a comprehensive treatment protocol, ensuring she understood each step to recover quickly, especially with that big swim meet on the horizon. Ear drops, antibiotic steroid combination. Dr. Hernandez prescribed ciprofloxacin 0.3% plus hydrocortisone 0.1% ear drops, a potent combination to tackle bacterial infection and reduce inflammation. Dosage: 3 to 4 drops in the affected ear twice daily for 7 days. She instructed Sarah to lie on her side for at least 1 minute after applying the drops to ensure they coated the entire ear canal. Pain relief: anti-inflammation, over-the-counter ibuprofen 400 mg every 6 hours as needed for pain. Dr. Hernandez also recommended warm compresses to the outside of the ear to soothe discomfort. Ear canal care: Sarah was advised to keep the ear canal dry. Use a shower cap or ear plugs while bathing. Gently dry the outer ear with a clean towel if it gets wet, but avoid inserting anything into the canal. No swimming or water sports until the infection showed significant improvement. Follow-up: Dr. Hernandez asked Sarah to return in 5 to 7 days if symptoms did not improve or if they worsened. If her ear canal remained swollen, an ear wick could be placed to ensure the drops could penetrate fully. Sarah breathed a sigh of relief. She also felt a pang of disappointment about possibly missing the swim meet. But Dr. Hernandez offered hope. With proper care, she might be on her way to recovery sooner than she thought. Turning the corner, Sarah followed Dr. Hernandez's advice meticulously. She set alarms on her phone to remind her of the ear drop schedule, taking great care to dry her ear after each shower. By day 3, the burning pain had eased significantly, and the foul discharge had dwindled. Encouraged by this progress, Sarah avoided the pool, but practiced land exercises to stay in shape. On the 5th day, she woke up to find that the itching had almost completely vanished. She returned to the clinic for a brief checkup, where Dr. Hernandez confirmed that her ear canal looked much healthier. The final reveal: by the 7th day, Sarah's ear felt normal again. No more throbbing pain, no discharge, no swelling. Dr. Hernandez cleared her for light swimming, instructing her to use well-fitting ear plugs and to thoroughly dry her ears afterward. Sarah was elated that she could still compete in the upcoming swim meet. The once mysterious ear ailment had revealed itself as otitis externa, commonly known as swimmer's ear. Thanks to proper diagnosis, diligent care, and a dedicated treatment regimen, Sarah was back to doing what she loved. Epilogue: a lesson learned. 2 weeks later, Sarah swam her best race ever, capturing 2nd place in the 200-meter freestyle. More importantly, she emerged from the pool with healthy ears, having learned a valuable lesson about ear care. She'd become more vigilant about drying her ears and wearing protective plugs. No longer was swimmer's ear a mystery lurking in the depths of her ear canal. She was a champion, both in the pool and in taking care of herself, and so ends the mystery of the aching ear, a lesson in the power of early diagnosis and the importance of following a well-crafted treatment plan.